but it's good habit to start writing notes. Okay, so yeah, we can start with
Yeah.
the
Kanchan, you
first
have
slide.
raised your hand. Is there something you want to say? You can unmute and then say.
No, sir, this was the one when you asked how many of you are MBBS.
Okay, okay, sorry. Then I will lower the hands.
Okay, all the hands are like Santoshi. Yeah.
Okay, great. See now, small things like when we say, everyone put your video on, and then there are many people who say, I am not going to do it. That this habit of not putting on, listening to what is being said shows that you are trying to take shortcuts. And in my almost 30-40 years of teaching and training in critical care, I've realized that these people don't do well because you don't listen to teach. You say, I am very good. It's so simple. Anyone comes with fever in the ICU, give 6 antibiotics, give steroids, give antifungal and anti-tuberculous drugs. He has to get well. I know this. Why should I listen to lectures? This type of attitude doesn't help. Okay. So unless there is a serious reason that you're in your gown or something and you cannot put on your video, please put your videos on. Okay. Okay, 1 second.
No issue. We need the next slide, sir.
Yeah. Now, there are various components of the exam, especially because it's going to be a physical or offline exam. There are certain mandatory requirements. Now, just because you've paid the fees and you've registered yourself does not mean you will get to appear in the exam. You have become eligible, okay, to undertake this course. In order to be able to give this exam, you must accumulate 200 academic credit points in this year. Now, there are some people who did given the PCCM exam, and so they're aware of what academic credit points were. In
Most
part
of them
one,
have given the PCCM and come for the FCCCM. There are only few candidates who have exempted from part 1 and now they have come for part 2. So basically for everyone previous year and on the site also, yet it says 120 ACP points. But from this year, it's going to be 200 ACP points for you. That is basically because there is going to be a lot of training activity and we want you to attend that.
yeah, and remember, last year's ACP points don't carry on this year. You say, oh, I already got 120 or 150 points. I will submit the same one. No, last year's orientation program was last year's orientation. That certificate cannot be used now. The crash course cannot be used now. The conferences cannot be used now. It is in this academic year that you have to accumulate 200 ACP points, and we will share with you what are the various activities that can give you ACP points. In the online classes and online activities and offline activities that are there, you need to have 75% attendance. Okay. They're going to be, so once you get 200 ACP points and you submit your diary, which is an academic diary we will tell you about, which shows that you have attended 75% of all the activities, you can then appear for the exam. There will be a theory paper, there will be 2 papers, paper 1 and paper 2 of 2 hours each. You will physically with a pen and paper write it there. Okay, so you don't have to type. There will be OSCE stations. Now, in part 1, you were familiar with 5-6 OSCEs. In part 2, there are going to be 10 different OSCE stations. And unlike you, because you are typing, you got 20 minutes. Here you will get just 12 minutes, of which just 10 to write the answers. Vivas, you will have total of 4 vivas, including one for communication. There will be hot case, that is ICU case presentations actually, where you don't have to take a history, but you will have 2 cases that you need to present to the examiner and participate in a question answers. And throughout the year, every month, you will be submitting PowerPoint presentations in a particular format. And the best of the lot, there are about 35 candidates, Meeta, who are giving the part 2 exam, out of which in any month, 8 of you will be selected to make a presentation based on how good it is. Now, why should you make a presentation? You should say, good, now let me not work, someone else will get to present. If you present, you get more ACP points. Okay, and that comes to your credit. So the more presentations of yours that are approved, you then get a much higher ACP points. And each of these components roughly has about 100 marks, and they're added up. Meeta, can you take about the papers, theory papers?
Yeah. So theory papers, this is available on your ICUeducation section, ICUeducation.com, in the download section. Those who have given the exam, first in paper 1 and paper 2, you will see most of the topics are same. I have ticked the something which is more in FCCCM is in paper 1. You also had in primary exam common problem in ICU, but here it is going to be more elaborative. And common problem in ICU is very common in our day-to-day things, like patient coming with hypotension, patient coming with breathlessness, patient coming with abdominal distension, patient collapsed, post-operative surgical. So these are the common problems with which patient will come to the ICU, and that typical scenario will be given, and you will have to answer. Now in paper in FCCCM, this theory exam, it is all going to be scenarios in the ICU, whether they are short notes or they are long questions. So every question is practically, so more than 90% of the paper, there will be a scenario. So it is as if you are seeing that particular patient in the ICU with some problem which is given there, and you need to give a solution. So that actually tells us how sincerely you have worked throughout the year with your theoretical knowledge application at the bedside. So in theory paper 1, there's a common problem in ICU. In theory paper 2, 3 important things are there. And the topmost is again transplant critical care, because that is now going really high in India, and you must know, especially people who wish to then go to abroad, it is important for you. Also people who wish to work in a higher centers with multi-speciality units who have transplant critical care, this is important. So we prepare you from that point of view. So you will have question in the theory about transplant critical care. You need to know about some landmark studies and guidelines in critical care, which we will be preparing you again. We will be giving you certain topics, some material, and remaining you have to, of course, do little research and give us a PowerPoint presentation. So indirectly you will prepare yourself for this question. And critical care procedures. So previously we used to take this in a Viva section, but here you have to write it down. So this can be any procedure in the ICU, right from putting a central line to pacemaker or plasmapheresis or hemodialysis, anything. So it will be about procedure related things, indications, complications. If it is routinely done by the intensivist, then it will be a method of how do you do that procedure. So everything related to that procedure can be asked in the exam. So that is about the theory. You remember in the online exam, you were given, I think, 150 minutes instead of 2 hours, 2.5 hours, because you had to type, and we know doctors are not good at typing. But since this year it is going to be physical examination, you will have 2 hours. It is very important that you write what examiner understands. In this exam, it is not considered, okay, if you have written something, I should consider it to be correct. If you do not understand what you have written, you do not get marks. So start writing in a good handwriting, not a typical what people say about doctor's handwriting. So that is about.
And doesn't have to be long descriptive sentences.
Yes.
Just to the point, yes. 1, 2, 3, 4, 5, very important. Just that's what is important.
Yeah. So in past also, people who have given theory, you may have written just 5 points, 1, 2, 3, 4, 5, and all 5 points are correct. And there may be some person. Just 1 second. This battery is going low. One second.
Yeah. Now everything is going to be covered.
Yeah.
As it is internationally. So your echoes, ECMOs, hemodynamics, everything needs to be there. In the past, some people have come and told me, sir, in my hospital, there's no transplant happening. So please exempt me from the transplant question. It is like saying that, sir, in my town, there is no airstrip. So please exempt me from taking flying lessons and make me a pilot. Will you like to sit in the plane where the pilot has been exempted from flying classes because in his village or town there was no airstrip. No, so it's not acceptable. If you don't have some facility, you don't have a dialysis in your hospital, try to talk to your friend and see that you take some rounds in places where there is dialysis going on, in which there's transplant or whatever that you can discuss, post-op cardiac surgery care, post-op neurosurgical. There is no excuse, it's not there in my place. Okay, so
So yeah, so what I was telling, so there may be a question for which some candidate may write just 5 points, 1, 2, 3, 4, to the point, and there are candidates who have written three pages. The candidate who's written just 5 points and all 5 points are correct, they get 5 out of 5 marks. And the candidate who's written 3 pages, and if there is nothing significant to the answer, you get 0 marks. So it is not about how many pages you write, it is about what quality you put in that. So it's all about qualitative in the exam. We really don't want you to write the essays. To the point is important. So next. So next slide.
yeah.
Yeah, so in the OSCEs, you have 10 components. Now, those candidates who have given the exam PCCCM, they know they had 7 stations. First 6, of course, ABG, ECG, biochemistry, hematology, coagulation, X-ray, CT scans, and you had drugs, equipments, and graphs. So, drugs and equipments is out from FCCCM, but there are 4 other more OSCE stations which are there, which have been actually included from this year. This is almost a preparation of an advanced fellowship, and it is actually important. If you are going to be a consultant level intensivist, you should know these topics. So the remaining 4 which are new are, one station is a microbiology station, which will have antibiograms. We will take lectures somehow in between. I mean, there's a lot of training which is scheduled this year, so we will be taking on antibiograms. All other fluid analysis except the one blood biochemistry which comes in biochemistry. Other fluids like CSF, urine, uh, sorry for double typing of CSF, peritoneal fluid, pleural fluid, anything else can come in the microbiology. So that will be a microbiology station. Then you will have this year medical statistics. We must know how to read papers and how to analyze what papers are good. And we will be taking lectures on that also. We will be giving you data about medical statistics. So out of that particular data, you will have 4 questions in the exam, like how you have data sets, how you already have in primary exam data sets, data interpretation material with you. Those who have just joined after, I mean, directly as an exemption, we will be providing you the data sets and we'll tell you what is it, or you can just log in during the part 1 upcoming on from 14 to 17 September. PCCCM orientation training program is there, 4 days. Most of you have gone through it. So those who are interested to re-attend that, or those who have taken exemption, actually it's not compulsory, but I think you should attend the lecture, the full orientation program, to have an understanding of how the teaching is there and what do you expect in the exam. So that is about it. Then next station is graphs. Here it is going to be all the graphs. In your first exam, you just had one graph. Here it will be ventilator graph. It can be any other graph which we see in the ICU. Last will be hemodynamic monitoring. In hemodynamic monitoring, you will have 2 data interpretations. So there'll be data about some hemodynamics, and you have to interpret based on that what is a problem in that particular patient. And we will be taking the lectures on that, and few data sets will be given to you, and there'll be 2 pictures of echo and USG in the ICU. So we have to go through. You should have training in bedside echo and bedside USG. How any patient's problem is picked up at the bedside by using 2 hemodynamic monitoring parameters. So that is important. And whenever it is possible, we anyways, I think in next year February or March, we are going to have a physical CME, or the training program, where we'll be taking a workshop on ventilators, echo, USG. Lot of good things are planned during February or March. We will let you know when it is finalized. It's worth attending. I think you all must attend it. So that time we can take about echo and USG, and of course hemodynamic monitoring. I told you we will be taking a lecture and we will give you data. So that is all about OSCE stations. Now, in online exam, you had OSCEs which were given to you. So you could see all four OSCEs and you had 20 minutes for four OSCEs. When it comes to physical, it's totally different. In physical, again, you will be presented with four OSCEs which are stuck on a table and you get 12 minutes only. Of that 12 minutes also, you just get 10 minutes to write. Initial 2 minutes you are just reading what is presented to you, which one is easy for you to first write. Exactly after 2 minutes you will be given a bell to start writing, and in 10 minutes you finish that station and go to the next station. So you give all the OSCEs at one go. There'll be no time like 10 minutes, 15 minutes, half an hour. No. Moment you finish one OSCE, you go to the next OSCE station. And this mock exam, because you will be giving first physical examination, we will definitely take whenever we take physical crash course. Last year you had online crash course. This year we will have physical crash course, and during that time we will take a mock examination on specially OSCEs, that how you'll be moving around during the final examination. So that is about the OSCE station. Sir, anything else you want to add in the OSCE station?
Yeah, I just want to say some people who have registered directly for FCCM were asking how is today's orientation different from the orientation course that is there. In the orientation course, which is going to be 4 days, you will have detailed discussion on how to approach an arterial blood gas, ECG, X-ray, CT scan, hematology, coagulation data, etc. and in tremendous depth, because it's an orientation program, even much more detailed than a crash course. So maybe 2-3 hours will go just in arterial blood gas, how to pick up abnormalities, how to answer, what are the problems that you face, etc. So ABG, ECG, biochemistry, hematology, X-ray, CT scan, all those, and maybe if we get time, then maybe antibiotics we may talk a little bit on. So this is what will be covered. Today what we're doing is we're just giving you an overview of what are the aspects that are there. Those who are directly giving the part 2 exam, my advice is don't make the mistake of missing the orientation program. What about people who gave part 1 exam and are now giving the part 2 exam? They've already attended it. So really for you it's not necessary that you join. But again, in my opinion is, many candidates would love to have a refresher course just to remember. It's like when we read a chapter 2-3 times, every time we read we learn something new, we learn something better. So it may help those, even if you've given part 1, to attend it, but it is not compulsory. If you've got some other commitment or there are financial issues, then you can certainly skip it. Okay. How do we then proceed? Meeta, do you want to take this?
Yeah, I can take, sir. So how are we going to proceed this year? How do we go through the whole exam process the whole year? You will be provided with academic diary. Dr. Jain will send you.
I will show them in the PPT today.
Yeah.
We will show them.
Yeah. So there'll be an academic diary which will keep a record of throughout your activity. It will be submitted between 1st to 5th of every month by you, and then finally before the exam, whenever we tell you. So why? Because see, we are in a habit of, unless you spoon feed, you're not going to eat. So if we tell you, okay, submit at the end of the year, people wake up only 1 month before the exam and then they start making it. This year we are, and then that preparation is horrible. You're just working to pass your exam. No, we want to really prepare you as fine intensivist as soon as you finish this exam. So that is the reason from this year onwards, so that a lot of new things are happening from this year. So one of these activities, academic diary, and Dr. Jain will tell you about it.
Yeah, I think it's so important that if you go anywhere outside India, okay, abroad, Europe, America, Australia, etc., your academic diary is more important than your certificate. Can you imagine that? My own son, who is a consultant in Europe in critical care, to get approval, you have to submit evidence of training which is more than 1,000 pages, not 500, not 800, more than 1,000 pages. And the most important thing is the academic diary. They want to know which date you put center line, which date you did this, whom was there, did you have complication or not, of course with the patient's identity removed, everything. How many patients of pancreatitis did you see in your training? How many patients of post-op esophageal surgery or malignancy did you see? So the academic diary is going to be your best friend throughout the year, throughout your life, professional life. And what you need to do is, we will discuss this, but between the 1st and 5th of every month, you need to write down your previous 1 month's data and submit it to the college and keep doing it. Okay. The academic ID number and card is been prepared. Some of you have not sent your photograph. If you have not sent your photograph, I will wait for today. And then if you don't send it, then your ID card will not be prepared. You need to print and laminate this card. And because I know we are very often we lose one card, print two, laminate them back and front, and then you will be need to present this as your exam admission card in anything that is there as proof of being a student of the college. You will need to submit this. Sorry,
Yeah,
Mika.
like so whenever you are attending, say Wednesday lectures or any teaching activity, your attendance will be, you will have to put your academic ID number. Okay, so that is what everywhere, any activity you do, you present a PowerPoint presentation, you will be writing your name, your academic ID number over there. So your card should be, and before you show the card and then you start your presentation. So your academic ID number is going to be very important throughout the year for you to get that academic credit points and of course from the exam point. The third important thing which we are introducing this year is worksheet. This you people are familiar, those who have given the part 1 exam like PCCCM exam. I used to send you, or college used to send you preparations for online OSCEs, ECGs, or 4 ECGs, 4 CTs, 4 biochemistry, repeated trial exams we used to send for you for online typing. So same way, we will be sending you worksheets throughout the year, every fortnight one worksheet, which may be a mix of anything, mix of some one question, one ABG, one CT scan, anything. That worksheet will come to you. You have to submit it. It is compulsory for you, and submit promptly. That is compulsory. That goes in your academic diary. That goes as a part of your academic credit points, and that is the preparation of your examination. We are going to take a lot of efforts to prepare this and send it to you. And most of the times, trust me, whatever we send you worksheets throughout the year, at least 25 to 30% of that comes in the exam. So that is how you are preparing right from the beginning. So please don't lose out on worksheets. Then fourth important component which is there as a part of your training and compulsory, which has also marks in your final exams, is PowerPoint presentations. So you will be given PowerPoint presentation throughout the year. We will give you topic 2 weeks before. You will have to prepare and present that on every Wednesday. Okay, everyone who's been given prepares the topic. So throughout the month you have 4 Wednesdays. Every Wednesday 2 candidates will be given the topics. I think they will have to present in 20 minutes. So 2 candidates will finish in 40 minutes and remaining 10 minutes for their question answers or any doubts. So 20 minutes PowerPoint presentation on particular topic which will be given to you. That carries marks and it is compulsory. So every month 8 candidates will present PowerPoint presentation. So that is activity which you will be doing on Wednesday, and we will be judging you and giving marks during that time. Topics
I just
will be
want to
given
say
to you
one
by
thing, that
college.
you will, the choice of topic is not yours. The college will give you a topic. All right. So all 35 candidates will prepare the topic that is given to them, not two, but one topic. Before Wednesday, that means latest by Monday, you will have to submit that to the college. They will be reviewed, and the best presentation will get a chance to present it on Wednesday. All right. Whether you get a chance to present or not, there is it still has to be prepared. All right. It's part of your training. And ACP points will be given to those who are actually getting to present.
Yeah. So those who are selected after submission on Monday, you will be given ACP points for presentation, and you get two ACP points. I think 2 or 4. I don't know. That is there on the site, but you will get more ACP points for presenting because you've been selected. So see to it that your presentation is best, so that every time you get selected and you start accumulating your ACPs, that will prepare you for the future also. Whenever there are CMEs, conferences, seminars, you'll be picked up as a good speaker for PowerPoint presentation. You need to join Google Classroom. Those who have given PCCCM exam, you know already how it is, but we'll be sending you again the link, and you have to join a Google Classroom. You need a Gmail account for that, and academic ID number to register and login. So that's why academic ID number is very important. Please send those who have not sent the photographs. Please send it by tonight, so that you can receive your academic ID cards. You will have online lectures by renowned teachers. So on Fridays, so basically every week you will have 3 academic activities online. On Wednesday, you will present to us. On Friday, either there will be discussion on the worksheet which was given to you, so it will become alternate Friday, or some of the teachers will take a lecture on that day, but it will be a smaller topic, which will be around 35-40 minutes lecture. So some renowned teachers will take, or there'll be discussion about your worksheets on that particular Friday. Again, there are ACP points for attendance of all the online academic activity. On Sunday from this year, we have introduced master class, which will be 2 hours in-depth teaching. Okay. Begin with majority of the lectures, we will start taking Dr. Jain and me, and trust me, it is not supposed to be missed. It is real in-depth teaching of most of your topics covered throughout the year, which are from exam point of view important. So that is how you don't even need to refer your books for those particular topics, and your day-to-day seeing patients will also help there, because that is basically the concept is right from your basic understanding of that particular disease to what are the current guidelines on the treatment. So what will you do if this particular patient comes to the ICU? How will you treat? So it's a real in-depth teaching program on Sunday. So masterclass activities will start from, I think, anyways, we'll be announcing it on the group. I don't remember it. Again, it is mandatory, and ACP points are there for the attending the same. Sir, anything else you want to?
Yeah, this is what an academic ID card will look like. Yeah, as I said, you need to print it, laminate. There's the front side here and the back side there. And what it will contain is it will contain your photograph, your name, which exam, whether it's a fellowship exam or primary exam, your academic ID, like in this case, F2301, not very difficult. F is for fellowship, P will be for primary. Year 2023 is when you give the exam, and your number which will be there here. Your college membership is here, your contact number is here, and the validity of the card. On the back side, there are 2 QR codes. This is the first one is for the college. So if you click here, you go to the college website, ICUeducation, and the second one you go to the College of Critical Care website. Okay, so this is what you need to present as your proof of ID. The academic diary, as I told you, between the 1st and 5th, you need to submit. No excuses. Because if you say, sir, if this happened, I will submit on 8th or 9th. No one has the time now with this busy schedule to keep track of yours. So attendance of lectures in that month, yes, you will attendance of 75% is compulsory throughout the year. The PowerPoint presentations that you gave, okay, the ACP points will be there, and you need to minimum have 3 presentations in a year. That means, suppose the good ones who make good PowerPoint presentations may even give 10, 12 presentations in a year and get a lot of ACP points. But the not so good ones, every time they just do cut and paste. Some letters are 12 size, some are 8 size, some are whatever, all just for the sake of doing it. They won't get a chance. But you somehow need to have at least 3 good presentations better than the others, because if you don't have minimum 3 presentations, then your ability to give the exam may be in doubt. Worksheet submissions, you need to complete and submit 75% at least. Attendance of workshops, conferences and seminars also go in the academic diary. I will show you the diary. Logbook of procedures performed and the cases managed, you will need to fill up. Worksheets and weekly classes. All PowerPoint topics to be submitted in a specific format. How it is to be done, I will let you know. But a minimum of 10 PowerPoints is mandatory to be submitted in a year. Presentation, minimum 3, but at least minimum of 10 presentations in the format that is required, you will need to. And I will be taking a few sessions on how to prepare the PowerPoint presentations. Now, this is the academic logbook that is there of the college. You download the academic logbook, and immediately when you download it, rename it to yourself. So suppose I was there, I would name the academic logbook as Praveen Jain Academic ID FCCM2023 Okay. Now when I rename it, every time I update and every time I submit it, it's not going to be overwritten by someone else submitting it. All right. Here on, you will enter your, it's a Word document, so you can definitely enter your name, academic, roll number. Roll number you will not initially have. You will enter it just before your exam, institute, city, and which batch you are in. The index page, lectures attended, presentation prepared and submitted, presentation delivered live, workshop, seminars, CMEs attended, procedures performed, cases managed, and miscellaneous academic activity. Which page is the detail on? Of all the lectures attended, how many total academic credit points did you get? You will put here. And if you have a supervisor or your teacher or your mentor, they need to initial it before you submit it finally. This is the CCF lectures attended. So here you only put down the lectures which are by the College of Critical Care Medicine. There may be lectures held in your own institute. There may be lectures held in your city which you attended. There's a separate place for that. So here the topic, the date, who was the speaker, and how many academic points. Usually just attending a lecture is 1 academic point. Okay, presenting it will have more academic points, etc. So this is where it is. Then about presentations prepared, you have about 25 here. You can put the name of the presentation. Did you present it or not present it, and what are the academic points? The presentations that you actually delivered, presented, will come here. These are the workshops, seminars, conferences. So you can put down the topic or where was it held. Suppose it was a 4-day conference held in Nagpur, organized by this. What were the dates? Speaker for a conference, you cannot have the whole list, but you can put just one. The organization you can put down. Suppose this is Indian Society of Critical Care, Critical Care Education Foundation, or some company. And if there are academic points associated with that, you can put here. Then procedures performed, you will need to put the date, the procedure. Okay, what was the indication for doing that procedure, and were there any complications or anything you want to mention about it? Okay. Cases managed, same way the date. Now here, what do you put down about the case? We're not asking you a lot of details about it, but 36-year-old male with breathlessness and pain in abdomen, pancreatitis, operated. Just few words about salient points, and then get them initialed by the supervisor. We're not going to ask you proof about it. So if you want to bluff, you think that that is going to help, it won't help you, because when you submit this internationally, they will ask for proof from your institute. So on that day, it was such a case admitted, etc. And trust me, they're very aggressive with verification. Meeta, back to you.
Yeah, so of course you will have when you click on the barcode on the academic ID card, it will direct you to ICUeducation or College of Critical Care. And when you go to the download section, and you will find out what are the ACP points, how do you collect ACP points, or you get how many ACP points for particular section. Those who have already done it last year, they know, because you had to give 120 ACP points. So there are few more little more changes in that which will be uploaded and you'll be able to see. Since you have already given orientation last year, this year you do not have orientation course. This is just an orientation session right now for the overview, but it is not an orientation course. So this year, major chunk of 30 ACP points at one go will be only crash course, which will be physical. You'll be attending. So there you'll get those, as sir told you, want to still wish to attend a orientation of part 1, can go ahead and attend it, and then attending that you will get 30 ACP points again. Whenever we conduct crash course physically, immediately after that your theory paper will be conducted, and it will be approximately in June 2023. Final practicals, which will include Viva, OSCEs, and case presentation, will be conducted usually after 1 month of your theory exam, usually, not perfect, and it will be in a common center in India. Of course, theory also will be one common place where you will be all coming to give the theory exam physically. So approximate, the dates are not final, but the month is final. You will have your theory and crash course in June 2023, and you will have your final practical exams in July 2023.
It's not just 1 year. It's saying that, oh, it's a 1 year. It's really the rest of your life. And I saw an ad which comes on television, and they say, a man tells his father that the best advice you gave me was, it's not about 4 years that you spend in medicine, or 5 years you spend in medicine or engineering. It's really about the rest of your life. And it's not just clearing the exam which is important, but succeeding in life as an intensivist. And therefore, while you may think, okay, let me cheat and pass the exam, you cannot cheat and pass in real life. Can you cheat and say the ARDS patients will recover, the PO2 will improve because you cheated, etc.? No, your colleagues will not listen to you, your patients will not survive, you will have higher complication and death rate, and your career is finished. So it's very important to be a good intensivist. And the only way you can do this is by discipline and practice and practice and practice. The question sheets that Dr. Meeta will be posting regularly for you is all about practice, practice, practice. Okay? And discipline, I cannot emphasize enough about how important discipline is. I really pity people who think or who tried. There are only 2 times. Once in 2004, someone cheated, and then this last year, someone cheated. So in between, no one ever cheats in this exam. Because throughout the year, we try to train you to be a good intensivist, to be a good speaker, to have good values in life. And that's how anyone who has done FCCCM, the public, the community, the medical fraternity knows that these are good people. That is why I will not give you the name of a hospital, but one hospital in India, major hospital, made an MBBS with FCCM as head of the critical care, and MD doctors were working under him and students under him. All right. That speaks of the recognition that this course brings along with it. So, but you will do that only if you've actually learned, if you've learned to analyze properly, when you're given a problem, how do you think, how do you rule in the possibilities, how do you rule out and exclude other possibilities, is the training that you need to get. By cheating and looking at the books, it doesn't help you at all. So I really pity people who take shortcuts in life, because they will never ever succeed. They're just wasting their money. in these exams. People who are good want to be good. Dr. Meeta, myself, rest of the teachers, we are all there for you at any time to help you practice and train. Okay, so it's all about
Sir,
lots of practice here.
the two things we forgot to elaborate was one was vivas. You gave online vivas this time. That was just not so quality which we actually expect in the physical exam. So this time you have four vivas which are physical because it's going to be during the final practical exam, where you will face four different examiners. Same way, how we showed you a 2 minute scenario to read, same way a scenario will be posted on the door. You read it for 2 minutes. At the end of 2 minutes, the bell will ring. You go inside. Examiner will take the viva. That viva will be approximately 9 to 10 minutes each time. The moment the bell rings, you go to the next station. So you will have four stations, out of which one station is communication station, compulsory, where you will be facing a very difficult uh, relative,
Relative.
very difficult relative who is actually is an actor, but he's been trained to be a difficult relative, and candidates in past have cried. These are the kind of scenarios which we come across in our day-to-day life. How do we manage them? Even the most difficult relative, if you are able to manage, there'll be never problem in the ICU, because it's all about the communication. If your communication from beginning to end is good, even if there is a complication or patient dies or something happens, relatives will always be in one-to-one faith in you, and there'll be no problems. The problems occurring in our current scenarios are basically because of zero communication or miscommunication. So a lot of emphasis is on communication. We will be taking during the crash course few scenarios as to how the communication will be examined in the final examination. So that was about the communication.
Even
So
in
you
this
will have,
orientation this year, Mita, because
yeah,
last year it was online and this is going to be offline. In orientation, you will
crash
actually
course.
get to see photographs of the past, each component of it. How do you stand in front of the door? How do you read the questions? How
Uh-huh.
do you sit? How do you interact? What about body language? So all those things are going to be discussed in the orientation program for the
This is,
physical exam. How do you move in an
yeah.
OSCE station? How are the rest stations? Which side you should face? So all that is going to be covered in the orientation. And communication, we will have sessions in between on what are the common mistakes people make in communication. Okay, and so that all will be
So
covered
that
up.
was one. Yeah. So during these sessions on Fridays, which we'll be taking, some of the Fridays we'll be definitely taking lectures on communication from exam point of view. We'll be taking lectures on other points as sir has already discussed. And the another thing was ICU case presentation or hot case presentation. This is totally new for everyone because this year you did not have a case presentation. Here you will be examining actual case in the ICU, and two cases will be there, and you will have total 20 minutes, of which around 7 to 8 minutes for examination. So the examination needs to be very meticulous, and you should not be missing anything, and it should be quick. So that is the training which we will tell you online when we take the lectures, so you can work that way throughout the year, because we expect you to pick up everything in those 8 minutes, the patient's examination, the surrounding, everything. So it's a training right from the beginning you need to get. So we will be taking a lecture on that, because as I told you, out of 20 minutes, around 7 to 8 minutes, or if there are more findings, maybe 9 minutes for the examination, and remaining time on discussion about the I mean your findings. What do you think is happening with the patient? What are the other issues of management will be discussed at the bedside? So that will be the most important part. And you cannot fail in hot case presentation very badly. Like out of 100 marks, if you get 30 marks, that means less than 30 marks in case presentation, ICU case presentation, even if you have scored 80% in other sections, you are considered fail in this exam. So that is what a very important station is, a hot case presentation or ICU case presentation. So in general, you will have, as I told you, uh, theory, OSCEs, vivas, and cases, ICU cases. Other than that, your academic diary and PowerPoint presentations will be separate columns with the marks. So out of these four main stations, you need to pass in three stations, but you cannot pass badly in ICU case presentation. That is, badly is 30% marks. So if you fall into that category, then you, even if you have got great marks, you'll be considered fail. So that is very very important. And about OSCEs, like you have 10 OSCE stations. You need not be. It's not compulsory to pass in every OSCE station. In general, overall, you need to have 50% marks in the OSCE station. So that was what I wanted to tell, sir.
Yeah, a lot of these points will be covered in the orientation this time. Is how to talk to your examiner when you know the answer, how to talk to your examiner when you don't know the answer. I think it's very important because it's a timed exam. How many students try to impress? Ah, sir, it's in the tip of my tongue. But you're wasting a minute doing that. It's not going to give you marks. Best is to tell him, sir, can we go on to the next question? I am having a thought block. Finish. But don't try, sir, it's there. I know it. I just read it yesterday. All these stunts and drama bazi useless in the exam. Okay. Second is the tricks and of how much detail do you give. If someone says, "How will you manage this unconscious patient?" There was someone who will say, "Oh, I will take an endotracheal tube. I will check the bulb. Then I will put xylocaine on the endotracheal tube. Then and out of the 10 minutes, 7 minutes, you're just preparing to intubate." There may be so much discussion to go on. So when do you do details? When do you say, sir, I will intubate the patient and I will then connect to the ventilator? So when do you go short? When do you go long? If someone says, okay, what about how will you manage this patient with pulmonary edema? Anti-pulmonary edema treatment, sir. That's not enough. What do you mean how will you manage this patient with status epilepticus? Sir, anti-epileptic medications. You're not being smart and you have to think that, sir, I answered right. I don't know why I failed. So, how much details to go into, how much not to go into, when are you wasting time, how not to waste time are all relevant when you have an offline exam. And therefore, even those who gave the part one exam, because it was online, you did not get these trainings. Okay, it would be worth it because this will be covered only during the orientation there.
And crash
How to
course.
approach even the ABG station, OSCE. The bad doctor, the bad candidate will start on taking, because 10 minutes, he will take the first ABG and he will start writing, but he doesn't know. So out of 10 minutes, 7 minutes he spends on one ABG which he doesn't know. Then the second, third, fourth he knew, but he didn't have time to answer. So how do you do time management in the exam? How do you do all this becomes very relevant as part of training. And therefore, I think that from now on, even for
Of course,
retrospectively, Nita,
every
we
time. Yeah, yes, sir. And of course, every time we will, let's say, suppose take a small session on ABG or any single ABG, every time we will be telling you that in the exam you will have 12 minutes for the ABG, of which 2 minutes go in reading and identifying which one is easy, which one you know, which one will you write last one. So practically, you have got 2.5 minutes per ABG, and the same applies to all other things. So that is how the training is going to be there throughout the year. So you need to read and answer and finish all the question. And remember, every ABG will have 2 to 3 questions. This is a final examination. So in 2.5 minutes, you are supposed to be calculating, finding the answers, writing. So this is very very important. Of course, we are going to give you a classical mock exam in crash course. So those who do not attend orientation, please, crash course you must understand. Anyways, your theory is lined up with crash course, so you have to come to that particular station wherever this theory which is going to be conducted. So it's worth coming 3 days before and attending the crash course, because you will be given a proper training as to how you will give viva, how will you have communication, how you will write the OSCEs. There'll be a mock trial examination of the OSCEs, so proper setup and few ABG questions will be put up there. So throughout the year we'll be telling you, so please attend all the activities. Anytime you have any doubts, you need to ask and clear your doubts immediately. Don't be ashamed that no one is asking. How can I ask? Be very selfish. Be very selfish. I don't know how many of you know, but I am the first student of this fellowship. I've given this exam in 2004, 18 years back. And I've never shied. If I don't know anything, I would ask at the time. So I think you should be very selfish, and if you don't understand anything, you should ask during the lectures or whenever you're working. You can just send it on the group or us. Whenever we get time, we'll solve it and let you know. So tighten your seat belts. You're going to take off from henceforth. This year, it is really going to be I would say more exciting rather than last year, because we could not communicate so much. And because this time it's going to be physical, we are really looking forward. Of course, we are, as I told you, we are planning a physical CME during the month of February and March. And most of you would definitely register, because some very important and nice topics will be covered during that time. Not our routine stuff, of course. So that will be our first physical contact. And of course, the second physical contact will be during the crash course and the theory paper. We get to know much better when we meet each other, because like even in orientation this year we are having online, but we used to have it physical. Still the things are not in a proper place. Crash course will have physical. You can stop, you can write, you can solve the questions. So physical crash course actually goes from the morning 7 8 o'clock to night 7 o'clock till your queries are finished. We go on. So same thing you should be doing for the, yeah. So that is all about the overview, exam overview. Someone
Okay.
was asking me personally on my number that what books to read. Part 1 or PCCM, it was very easy. You even if you have read textbook of O's, that was enough to pass. What about fellowship? It's vast. Anything you read is important. So textbook of O's, you can repay whatever material up to date, various journals. So there is no fixed thing in final examination. So that's all. Sir, anything you want to say or anyone wants to ask
Yeah,
anything?
one request is today, everyone who has not sent the photograph, please send the photograph. If your photograph wasn't, yeah, including I think Kanchan has not sent photograph, please send it as per specification that have been given, because any other size will not be acceptable. All right, you need to do that. Many of you have sent, so the ID cards can be sent to you. Unless you have your ID, you cannot log into the classroom. Many places you cannot log in and register. So you're teaching. If I take a teaching class tomorrow, most of you will not be able to attend because you cannot feed in your ID number, academic ID number. So you need to have that as soon as possible. Try and send it today. All right. That's one thing. And
Sir,
yeah,
the class timings.
beg your pardon?
Class timings. Class timings. Activity timings.
Yeah. The
Master class on Sunday between 3 to 5.
अरे उसका एआईसीडी कल नहीं परसों होगा एआईसीडी परसों होगा कल नहीं होगा।
someone is talking. 1 second, Deepak, I think.
आप यहाँ से, हाँ, ठीक है.
Okay. So the master classes will be on Sunday, but 2 to 4?
Sir, 3 to 5.
3 to
Post
5. Okay. So master class will be 3 to 5. And Wednesdays will be?
We used to keep Wednesday between 8:30 to 9:30. If it is okay with everyone, I think we should continue between 8:30 to 9:30.
8:30
Fridays
to
can be
9:30
shifted
p.m.
early. Fridays can be shifted early.
So everyone can pitch in and tell what time should. Friday we will have some teaching.
So
And
we can have it little early, sir.
we can
Maybe 4
also,
to 5.
some of the Fridays, what we will do is the worksheets that have been sent to you, we can solve the ABGs, we can solve the X-rays, ECGs. If we feel that many of you have got it wrong, then where you went wrong and what is the correct answer also can be part of the Friday teaching. So Friday will be what time?
Sir, maybe 3 to 4.
Does that suit everyone?
वो तो हर एक का कुछ ना कुछ रहेगा सर. They have to just log in.
Yeah, if someone or the other will have something, but it cannot be changed. फ्लाइट का टाइमिंग ये है, फिर आपका कोई रिलीजियस फंक्शन है या आपका कोई कुछ और प्रोग्राम है, आप यू डिसाइड वेदर यू वांट टू टेक द फ्लाइट और नॉट. ओके, दिस इज द टाइम इट्स गोइंग टू बी देयर.
That's why it is 75% attendance. Otherwise, we would have kept it 100% attendance. So you need to be attending 75% of the classes throughout the year for the same thing.
And you can
Ma'am,
only log in.
my suggestions.
Who is this?
Yeah, Syed Khalid Ahmed.
Yeah.
Yeah. Ma'am, my just a small suggestion that Friday would be a working day for most of us. So afternoon would be a bit difficult. I guess everyone would agree.
See, you while
See, no, Syed, let me just answer this. Mornings you'll be taking rounds. Evening, sir, it we after work we have come to our family. I have not met my bacha. I have not met my wife. She will divorce me if I don't talk to her. Night is for my parents also. I need to spend some time, sir, with them. Sir, can you take 2 in the morning to 4 in the morning class for me? Sir, I cannot attend. Can you take separately for me? Separately to. You have to be realistic about it. Unless all of you, because you must realize that we also have a life. We have our patients to look after. We have other things to do. You are just listening. We have to prepare. And many of the lectures that we prepare take almost a month of reading from so much places and to do it. Okay. So that days of spoon feeding is over.
see,
The other
that's why
question
what
some
we
people
did
have is, sir, I'm busy. Can you send me the recording later on? No recordings will be sent. You either attend it or you miss it. Okay, so there will be no recording henceforward that will be sent. Yeah, Meeta, you want to say something?
No, I said that's why initially we had an academic council meeting. Initially, we had kept the Sunday timing between 10 to 12 or 11 to 1, and everyone was of the opinion that whenever you get Sunday, at least for the teachers and those at the senior position and they have Sunday off, you want to get up late, you want to have everything late, and then you just don't want to jump at the master class for 2 hours. That's why we reschedule. Then they said at least once in a week it should be like that you are finishing when you are on duty, so you can listen. You have to just listen. You don't have to be on video whenever there's a lecture, so you can listen while you are on duty, or some of you may be off duty, on duty. So at least one day should be that before going to your house, your all work is finished. You don't want to carry now your whole day of work, and then again from 6 to 7 you have to log in, or 7 to 8 you have to log in at the house if you are at home. So everyone is bugging you, okay, that you are working the whole day in the ICU, and now also for 1.5 hours you are sitting. Because remember, you have twice a week activity which is going to be there. So one only activity we have kept where you have to be totally off, which will be on Wednesday between 8 to 9, where you will be presenting. So that is the only one area where it is not coming. Most of the times it is going to be coming during your duty timing or whatever, or when you have already gone home and you'll be resting or whatever. So that is the only thing. Other things you're already covering during your duty hours. So I think that should not be a problem. Only Wednesday you are presenting. Fridays and Sundays you're listening, isn't it?
Yeah. Okay, so the timings are done. Everything is done. There's one request that I have from all of you is, there are many things in critical care that we have to learn, but some things are very specific, and I want all of you to maybe send me 5 or 10 specific queries that you would like answered. Now, what is this? I'll give you example of what it is like. Okay, I've been asked to put a patient on ventilator. Do I start with 40% oxygen or 100% oxygen? What is correct? Or I've got a patient I put a patient on the ventilator and needed a blood gas, and the PCO2 has come as 60. How do I then readjust the ventilator? I know I've got to increase the ventilation, but what is the most appropriate? So these are specific questions, answers that can be given in about a minute's time. Have you understood this? Sir, I have a patient who is hypotensive. CVP is come 23. Do I put this patient on diuretic? Okay. So anything that is specific, if you can frame a few of them, then we will have a session where we answer these queries that you have which are practical. All right. So all of you can send it either in the group or you can send it to my number. There, any such specific queries related to critical care or decision making that are there, please send it. Okay. So in the next 3-4 days to do. Any other questions anyone has?
This is the only time you get to ask the questions. After this, we'll be asking you questions in the exams, in the sections. Yeah, I think I hope you've understood that this year is really serious teaching training program, and if you do it very sincerely right from the beginning, no one on this earth can fail you, because the training is going to be like that. You are filling up your academic diaries, you are attending the lectures, you are presenting, you are writing your worksheets and sending. So if you have done that much, you're attending the CMEs, you're attending the online lectures, that will suffice to make you a very good intensivist.
Okay, so
Madam, can we
Yeah,
if you can
Renuka?
just give your name, that's Renuka. Yeah.
Renuka, yes. So can we take the this thing for worksheet? We can take the cases which we had seen before.
No,
No.
No.
Worksheet.
Worksheets are specific questions like OSCE questions or medical questions that are given to you, and you have to write the answers to that.
The
Okay.
college will give you in the worksheet. The
Okay.
academic diary, I think you're talking about academic diary.
Academic
In academic
diary,
diary,
in
what cases that you will write what you're seeing
Seeing
when you receive
from
the
from
academic
now
diary
onwards.
from that onwards. So
Okay.
throughout the year, you're going to see so many cases every day in the ICU. If it is 8-bedded ICU, you're at least seeing 6 cases. If the occupancy is 80%, so you have lot of data. You do lot of procedures in the ICU, so you will have lot of data to write it down in your academic diary. So I think that you should not worry. If you're doing it sincerely, every day you fill it up, you're done. You don't have to bother about it. So if you're meticulous about this is all about discipline, and the person who is the most disciplined will shine out in the final exams and in the life, of course. So I think you got confused with the worksheet and the one which
Yeah.
you're going to enter in the diary. Worksheet we will be sending you online.
Okay. Thank you.
Okay.
But I'll be, sir, by today or latest by tomorrow, I'll be sending the topics for PowerPoint presentation, which will be there on 14th of this month, 14th September. So please prepare and send it by 12th September, because 14th is Wednesday. By 12th September, you need to submit your PowerPoint presentation. Of that, we will select 2 candidates who can present on that day. So topics I'll be sending you. Maybe in the
Yeah.
beginning, I'll give you some material also.
Let me just tell you here how it's to be done actually. It's not just making a PowerPoint presentation. Okay. It's about, see, if you make a PowerPoint, the person who's looking at it and not listening to you doesn't understand anything. Right? So below that, let me try and share with you a PowerPoint. You should all know, but let me just try to get a PowerPoint.
Yeah, so till he's sharing, it is like this. Many times it happens that the person who is presenting is reading everything what is written on the slide. You write something down on the slide and you just read that, and even the audience is reading that. So no one has interest in what you're teaching. So it should be, the presentation should be such that there are only 4 points, 1, 2, 3, 4, and you are explaining about those 4 points. You don't want everything to be written on that slide. Then only you can catch the attendance of the audience. So we don't want that you are also reading the same slide and audience is also reading the same slide. So that is of no meaning.
I'll just try and share with you what I mean, that basically what is different, going to be different. Zoom.
Sir, is it going to be possible to take a lecture before they present their first PowerPoint presentation?
I can try and do that, but
meanwhile they'll prepare. So basically you need to prepare in the same font.
No, they need to, let me just share a presentation with you. 1 second.
Like right now, what we presented you, the font was same throughout the slide, Times Roman. The font size was same. The heading was 32 and the second paragraph was 24. So it was throughout the slides, throughout the presentation, same. It cannot be in one slide, the font is Arial, the other times, other something else. So it tells us you have copied and pasted from somewhere else. At least if you copy, but at least change it to actual font.
Okay, can you see this? Can you
Yes,
see
sir.
my presentation?
Yes, sir.
Okay, now what I'm trying to say is, one thing is about making can you see my arrow?
Yes, sir.
Okay, so one is making these slides. Okay, that is, there's a little bit of teaching, but you can make these slides. But what you need to do is, you see these notes here. Okay, you click on notes and the note pane opens below here, right? Now here you need to put down what you would have said. So if you go, can you see this button called dictate? So if I click on dictate, I can actually type here. So welcome to this presentation on the FCCCM examination. Can you see it writing below?
Yeah, so you dictate and it starts typing.
So you may have to make the FCCM, it didn't understand, so you can correct it. And this way, for each slide, you need to dictate. Not point, not
Below in the
1, 2, 3,
notes.
4, 5, I'm going to expand on. No, exactly the words as if you're speaking. Because there are two ways. One, you can record your audio on it, which is fine. I have no problem with that. But if you put down exactly so you know what I would do in this situation. Let me actually dictate it and show you how it will come. So what I would do in this presentation is that I would invite one of the students to say something. So it is typed. So what I would do in this presentation, I would invite exactly the words that you want to say, you put down there. All right. And this is an easier way of doing it. Then when you want to record it, there's a button called record on top. Can you see this? Have I lost you?
No,
Yes.
no.
So there's a record button. If I press record, just 1 second, just give me a minute.
Yeah.
Okay. So if I present this record and record from this slide, current slide, what happens is the slide is being recorded and what I typed below comes here. So all I have to say is I say press this record button and say, so welcome to this presentation on FCCM examination. Can you see it writing below? So what I would do in this presentation is that I would invite one of the students to say something and then stop.
Sir, the writing below cannot be seen.
Writing you don't see? Oh, okay, okay. Maybe you, sorry, you will not be able to see it because it is not meant to be recorded. Okay, anyways.
Sir, but
I will
one
make a
query
video
from
on
my
it.
side. Sir,
I will make a
one
video
query-
and send it.
Sir, one query from my side.
Yeah.
The candidates who will send the PPTs will be presenting live on Wednesday.
They will present live, but the reason we back it up is that one, it is a practice for them to see how they present and where they get stuck, etc. And second is it's a backup. Remember from Bhavnagar, someone was presenting and then they had no internet connection. So at least we can play this recording at that time. So that's how it will serve the purpose.
Yeah, another thing is the best presentations recorded will be put up on the ICUeducation.com site.
Yeah. So I will guide you, but I will make a video on this how to do it. But once you write down here what you want to say, exactly the same words, recording becomes very easy and sending it. Okay. So maybe you cannot see it, but I will then make a presentation and send it. My mistake.
Yeah. So by tomorrow I'll send the topics, and maybe in 1 or 2 days, sir will send you how to prepare a small video on how to give a record and send a presentation, and few tips as to as I said, the background should not be very bright. It should be very simple, only few lines in one slide, same font, same size throughout the presentation. Wherever possible, not too much animations on lines and all, but explanation animations are fine. So those things, as you start preparing, initially it may be baby steps level. You are not going to be perfect right from the beginning, but at the end of the year, you'll be masters in presenting the PowerPoint presentations to us and to everyone. So that is, I think, is going to be a good speakers. Few good speakers from the whole group are going to emerge at the end of the year. That's for sure.
Okay. No, and Mita, why it's important is it becomes very difficult to know who is a good speaker or not from the PowerPoint, because someone will say, so the causes of pneumonia are one bacteria. What? So the content may be there, but he's not able to speak. He's not able. There's no variation in his voice. You will not know until you listen. Whereas the other person says the causes of pneumonia can be divided into bacterial. This so a lot of things you can make out only when you judge. And the purpose of judging you is to make you a good presenter. When you join as a consultant, other consultants will get to know you from the presentations you make at medical meetings in the hospital. All right. If you make a good presentation, they will respect you. And if you don't make a good presentation, then they'll say, this person really doesn't know. Or
And
people would just,
from the personal experience, from my student days to till date, more you do PowerPoint presentation, because to prepare one PowerPoint presentation on a topic, you need to read lot of material.
yes.
And whatever you present, you are the one to whom the people are going to ask questions. So you want to be thorough with your subject which has been given. So your reading background is perfect. So that makes you more and more confident as more and more you present the PowerPoints. So more you present, at the end you become more confident, because your knowledge is much, much, much better than others. And of course, knowledge is power. No one can challenge you with that. So I think more you present, that will make you more.
So when you're asked to do a presentation, don't pick it from the net. Don't pick it from the net. If you're going to listen to YouTube on that, just listen for the ideas, but don't. If you read, you've understood. So your theory becomes easy, your viva becomes easy because you've read it, you've prepared it, so you know it is there. When you record it, that's one revision. When you actually present it, that's a second revision. So that topic for you now, you don't have to prepare again for the exam. So the best person to benefit from a presentation is the person who's preparing and giving it. You can listen, you can be distracted or something. The listener never gets as much benefit. Okay, so do a good job, spend time on it, read about it, say what do I want to tell the audience. And remember, unless you're a big name, which none of you are. So if Amitabh Bachchan was to come on stage, everyone already anticipates what is he going to say and listen. But if some XYZ comes on stage, you don't even look. You're busy looking at your mobile, while they're changing, you're looking here, you're talking to your friend and saying something, you're all doing something. It is the job of that person to grab your attention. Okay, so if you come and say, I am Dr. Tanveer and I am going to be speaking today on the, he's not paying attention. He doesn't care it is Dr. Tanveer, and he doesn't really care. Unless you come out with saying, look, there's a rabid dog that has come into this hall. Or everyone say, oh, where, now you got everyone's attention. Then you say, okay, there's no dog, but not that you will start like this. I'm just saying you need to catch everyone's attention. Need to say, look, these many doctors are dying of COVID every week. Or like one person did, when the Zika virus was there, he actually brought a glass jar with mosquitoes inside and said, suppose I open this and these mosquitoes go into this room. Would you be concerned about Zika virus? Yes, I would be. Okay, I am Dr. Such and such, and I will tell you what are the risks of Zika virus. So grabbing their attention, then saying, and they'll say, okay, you say, Sara Azhar, I will be speaking. Why should I listen to Sara Azhar? I've never even heard her name. Maybe she doesn't have so much experience. Maybe she's just read from a textbook and come. How do you show that you are an authority that they must listen to you? Having seen 200 cases of ARDS in this year itself, okay, I want to tell you the practical approach to ventilating an ARDS patient. You say, oh, 200 cases, that's good. That's good. Maybe I learned something from this person. So remember, everyone in the audience is selfish. What do they want to know? Do you want to listen to how, these cardiologists, they come and give lectures on catheterization and they tell you, so you turn the wire like this and then you do, am I going to ever turn that wire? I want to know clopidogrel dena ki nahi dena, which I can use in my practice. Okay. So you remember that the audience wants to know what they can incorporate in their practice. They'll be more interested. Do I give theophylline or do I give salbutamol in a patient with status asthma? I'm more interested in that rather than knowing that the C receptors in the subepithelium, they do this thing. So these are some of the tricks that you must learn to hold the attention, to grab their attention, etc. And we're going to teach you all that to become effective speakers. All right. And once you can do that and you become a popular teacher, your general practitioners will call you for lectures, your associations will call you for lectures, you will become a city-wise prominent doctor, you will become a state-wise, then a national level doctor you will become. Okay, that's why these lectures are important. As opposed to it, what someone does, you go to Google, acute pancreatitis, good lecture, let me download, okay. And he doesn't understand acute pancreatitis, he's got these slides, many of them will have names of that person there, of the hospital, and he will make some presentation. Sir, karna hai, 1 point mein kuch to bhi milega mere ko. I will make some presentations. Who is going to get benefit of this? Neither the audience will be interested, you will be branded as a useless speaker. Next time, sir, usko mat bulao lecture ke liye. 1 घंटा bore कर दिया उसने हमारा, आपने इतने मुश्किल से किया. When you come to attend a lecture on, say, Wednesday and you're adjusting time, do you want to get useful, meaningful lecture, or do you want to get someone who's saying, and then, there are many causes, I cannot go into it. Sir, I'm going to speak on biomarkers in renal failure. I don't know why I've been asked to do it. I have actually no experience on this topic. The audience will say, if you don't understand, then why are you here to waste our time trying to explain to us? Okay, so what mistakes people make, what mistakes you shouldn't make, all that is going to be part of your teaching. And if you are going to cheat, copy from somewhere, we are not fools. 40 years of teaching, training, we've seen everything. Okay, there. And then you'll be sort of like, let's not waste time on this person. It's up to you. So we are going to do this exercise. How important presentation is going to be, very, very important. And we will start. I'm just wondering that if they're going to present on 14th, right, then maybe we need to have it in 1 or 2 days. We need to have that class because we're not here, Mita, in Bombay.
Yes, we'll announce it on this. And I'm going to give them very simple, some studies from critical care studies from last year, because they also have that in their final exam, some guidelines, some studies. So
maybe on day after tomorrow, take me 1 or 2 days to prepare the presentation. day after tomorrow, we can have at least some starter session on how to go about making your presentation.
We'll announce that on the group, sir.
Yeah. Yeah. Okay, so good. If there are no more questions, then we will adjourn here. Okay.
Who are the direct exemption candidates in the group right now?
Let me see if I can remember.
You can just unmute and introduce
Bhargavi
yourself.
is there. I think Bhargavi, you're taken exemption, right?
Where is she?
Sir, I, Dr. Aparna.
Aparna is also appearing directly.
So you can introduce yourself. Aparna is from Ruby Hospital.
Yes, ma'am. Ma'am,
Aparna, Atul Sharma.
Yes, sir. Dr. Atul. Sir.
So Atul is there, Aparna is there. Who else is there?
Bhargavi. No, you need to unmute yourself, Bhargavi.
Bhargavi, sir.
Yeah, Bhargavi. And
Bhargavi.
one more candidate. You have just written your mobile number, so I don't know your name. You can introduce
I'm
yourself.
Dr. Hello, ma'am. Hello, sir.
Yeah.
And hi, all. I'm Dr. Huma from OSCE Hospital and Asra Hospital.
Okay. Huma.
Okay.
Huma.
Hyderabad.
I think Huma registered for part 1, didn't give it, and then Una is giving part 2 because she's an MD anesthesia or something, right? Yeah, okay. So for all practical purposes, you'd be in the exemption category.
Okay. And Atul is from where?
Sir, ma'am, I'm from Gwalior, ma'am. Apollo Spectra Hospital, Gwalior.
Okay. And Atul and Bhargavi from?
Vizag, madam, Queen Sanare Hospital.
Okay. Fine. Good.
Okay.
So you all welcome to this new group because these faces we already know from previous exam.
Thank
So
you.
any questions, specific doubts, because you are totally unaware of the exam system. If you want, I think you can attend the orientation program. That will give you a fair idea. Although few you might find the topics when you actually go through the topics as basics, but that is hardcore critical care teaching from part 1 point of view. So I think
They are no way basic. They start from basic, but they're more advanced than most MD physicians will know. Okay, on the topic. They're very much in depth training, and I think we've always had some teachers and professors come and attend also the orientation when they were in physical form. So they're very useful.
yeah. So anything, Atul, Aparna, Bhargavi, Huma,